Hey guys, how's it going? This is FixerMed. Welcome to my high yield anatomy review series for the USMLE Step 1, NBME CBSE, and NBME CAS examinations. This will be part 27 of my multi-part video series providing a broad overview of anatomy for these exams. So without further ado, let's go ahead and get started on today's content. So I'd like to open up today by talking about the branches of the abdominal aorta, the celiac trunk, known as CA for shorthand, arises from the aorta at the lower boundary of the T12 vertebra. The superior mesenteric artery, shorthand SMA, originates at the lower edge of the L1 vertebra. Renal arteries emerge around the area of the L2 vertebra. The inferior mesenteric artery has its origin at the L3 vertebra, and two terminal branches, the common iliac arteries, arise at the level of the L4 vertebra. I have a nice picture to the right to give you a visual representation of the different types of arteries found as branches of the abdominal aorta. Let's go ahead and move on. Let's go ahead and take a look at the celiac artery in greater detail. The celiac artery, also known as the celiac trunk, originates at the level of T12 to L1, just below the aortic hiatus of the diaphragm. It courses superiorly above the upper border of the pancreas before bifurcating into three retroperitoneal branches: the left gastric artery, the common hepatic artery, and the splenic artery. Let's go ahead and move on. Next, I'd like to take a greater look at the left gastric artery. The left gastric artery ascends towards the left to reach the lesser curvature of the stomach, where it is susceptible to erosion by a penetrating ulcer in this region. Branches include the esophageal branches, which extend to the abdominal segment of the esophagus, and the gastric branches, which provide blood supply to the left portion of the lesser curvature of the stomach, which form an anastomosis with the right gastric artery. Let's go ahead and move on. Let's take a look at some questions. We have a 60-year-old male who presents with epigastric pain and is found to have a penetrating ulcer on the lesser curvature of the stomach. Which of the following arteries is most likely to be directly involved in supplying blood to the affected area in this patient? Alright, I think I gave you guys enough time here. If you need more time, please feel free to pause the video. Otherwise, moving on now. The left gastric artery courses upward to reach the lesser curvature of the stomach, making it the primary supplier of blood to this region. Therefore, in a patient with a penetrating ulcer on the lesser curvature, the left gastric artery is most likely to be directly involved in supplying blood to the affected area. Therefore, the correct answer here is A, left gastric artery. Let's go ahead and take a look at why the other answer choices are incorrect. The splenic artery supplies the spleen and is not directly involved in providing blood to the lesser curvature of the stomach. The right gastric artery primarily supplies the right portion of the lesser curvature of the stomach and is less likely to be directly involved in cases of ulcers on the lesser curvature. The inferior phrenic artery supplies blood to the diaphragm and is not directly related to the blood supply of the stomach. The hepatic artery proper supplies blood to the liver and does not directly contribute to the blood supply of the lesser curvature of the stomach. The common hepatic artery gives rise to the proper hepatic artery and gastroduodenal artery, but is not directly involved in supplying blood to the lesser curvature of the stomach. Let's go ahead and move on and check out the next problem. A 45-year-old female presents with epigastric pain and is diagnosed with an abdominal aortic aneurysm. Which of the following arteries is most likely to directly arise from the affected vessel in this patient? Alright, think I gave you guys enough time here. If you need more time, please feel free to pause the video. Otherwise, moving on now. In patients with an abdominal aortic aneurysm, the dilation of the aorta can affect adjacent arteries. The splenic artery, being one of the branches of the celiac artery, is in close proximity to the abdominal aorta. Therefore, it is more likely to arise directly from the affected vessel in this patient. Therefore, the correct answer is C, splenic artery. Let's go ahead and take a look at why the other answer choices are incorrect. The left gastric artery arises directly from the celiac artery, but is not typically affected by an abdominal aortic aneurysm. The common hepatic artery is another branch of the celiac artery, but is less likely to be directly impacted by an abdominal aortic aneurysm compared to the splenic artery. The inferior phrenic artery arises from the abdominal aorta, but it is not one of the branches of the celiac artery. The superior mesenteric artery originates from the abdominal aorta, but is located more distally and is less likely to be directly affected by an abdominal aortic aneurysm. The hepatic artery proper is a branch of the common hepatic artery and is not directly related to the celiac artery or the abdominal aorta in this context. Let's go ahead and move on to the next question. A 55-year-old male presents with severe abdominal pain. Imaging studies reveal an occlusion in one of the branches of the abdominal aorta. Further investigation indicates that the occlusion occurred at the level of the L2 vertebra. Which of the following branches of the abdominal aorta is most likely affected? Alright, I think I gave you guys enough time here. If you need more time, please feel free to pause the video. Otherwise, moving on now. The renal arteries originate at approximately the level of the L2 vertebra. Therefore, an occlusion occurring at this level would most likely affect the blood flow to the kidneys, resulting in severe abdominal pain. Therefore, the correct answer is C, renal arteries. Let's go ahead and take a look at why the other answer choices are incorrect. The celiac trunk originates at the lower boundary of the T12 vertebra, which is higher than the level of the occlusion. The superior mesenteric artery originates at the lower edge of the L1 vertebra, also above the level of the occlusion. The inferior mesenteric artery originates at the L3 vertebra below the level of the occlusion. The common iliac arteries arise at the level of the L4 vertebra, which is lower than the level of the occlusion. Lumbar arteries are not directly originating from the abdominal aorta. They arise from the posterior aspect of the aorta and supply the muscles of the back rather than abdominal organs. Guys, that will do it all for the content today. If you like this type of content, be sure to leave a like and subscribe for more videos like this. I would appreciate it if you guys could leave your questions, comments, or concerns in the comment section below. And that's all I have for you guys today. So this is FixerMed signing off. Be sure to have a great day, everyone, and good luck studying. Goodbye.